Good evening. I am Roberto Santamaria, your host this evening for Nantucket Pulse programming made possible by Nantucket Cottage Hospital Community Health Initiative. This is a special edition of Nantucket Pulse program that will air weekly covering the coronavirus impacts for the island and will provide urgent updates as they unfold. Today, I am happy to welcome friend of the show, Gary Shaw, CEO and President of Nantucket Cottage Hospital, and special guest, Dr. Josh Sharfstein. He is the Vice Dean for Public Health Practice and Community Engagement at Johns Hopkins Bloomberg School of Public Health. Previously, he has served as the Secretary of the Maryland Department of Health and Mental Hygiene, the Principal Deputy Commissioner of the U.S. Food and Drug Administration, and as the Commissioner of Health for Baltimore City. We will speak with both of them in a bit. Now, I want to provide a reminder to our viewers about the various emergency health orders issued over the weekend. Order number 5 allows certain type of construction work with crews of up to 4 people on site at a time. All such operations must submit an application to the Nantucket Building Department for approval. If a work site only requires a single worker, then the company needs only to notify the building department. However, the building department can shut down single-person jobs if it determines that the location makes it unsafe for one person to work there alone. Details are available on the town's website. Order number 6 cancels many of the restrictions on commercial landscaping from the first emergency order. Order number 6 allows up to 2 workers on site at a time. Details are available on the town's website as well. Both orders mandate that a COVID-19 officer be present at the work site to log information like the names of everyone that visits the job site and to interface with the town. Both orders clearly state that no employee shall report to work sick. The town can impose a fine of up to $300 per infraction. In emergency order number 7, the Nantucket Board of Health declared a public health emergency until further notice. It enacted many new protocols concerning essential services. For example, all employees of all essential businesses, as defined in Governor Baker's COVID-19 executive orders, shall wear a face covering over their mouth and nose when interacting with the public and within 6 feet of any coworker. The cloth face coverings recommended are not surgical masks or N95 respirators, which should be left for medical professionals and first responders. All essential businesses shall post a sign on their main entrance doors advising customers to wear a face covering and to limit the number allowed inside to maintain social distancing of 6 feet apart. These protocols and more can be found on the official document of Order Number 7, available on the town's website and social media. Governor Charlie Baker canceled the school year for all public and private schools. In a letter to the families of Nantucket children, School Superintendent Michael Kozort and Deputy Superintendent of Schools Elizabeth Hallett said, quote, "It is with mixed emotions that we share with you that Governor Charles Baker just informed the residents of Massachusetts that the school closure will be extended through the end of the school year. While we believe this is the best decision for the health and safety of our students and our community, it saddens us to end our school year without the traditional closure of the year. Rest assured, our staff and administration will be working diligently to find new ways to honor the achievements and accomplishments of our students. This decision obviously creates many questions and concerns, and we will begin addressing these as we consider each carefully. These decisions will not significantly change what we have created as a remote learning environment. However, we expect that we will receive guidance from the Massachusetts Department of Education as to what essential standards we should direct our focus for the remainder of the school year. As soon as we receive this guidance, we will share this with our staff and our students and their families." Unquote. There's good news coming from Beacon Hill for those with student loans. For several weeks, only federal student loans owned by the U.S. Department of Education provided COVID-19 relief. Borrowers of the loans do not have to pay back anything from March 13th and September 30th, nor do the loans accrue interest during the time. Now, the Massachusetts Divisions of Banks just announced that 15 loan providers of commercially owned federal family education program loans and private student loans will offer relief options to those struggling to pay during the pandemic. To learn more, visit the state's website and search student loans. There has been a sharp drop in travel to the island. The Steamship Authority has noticed an 85% reduction in passenger traffic. The airport traffic is down between 85 to 95%, depending on the day. The ferries are running reduced schedules. Between freight and passenger ferries, the steamship is running only 6 round trips per day at the most, and the High Line is only running 3. Due to this mammoth drop in passenger traffic, the steamship is losing about $1 million a week. They will run out of money by the end of May. To cut costs, they have been reducing services and have postponed the operation of the fast ferry INO until at least May 14th. Due to legal restrictions, they cannot redirect the millions of dollars worth of bonds raised to finance the renovation of the Woods Hole terminal to cushion its financial blow. If they run out of money, the Commonwealth will cover their budget, but then will bill Nantucket and Martha's Vineyard each 35% of the cost and then spread the rest among the port cities of Hyannis, Falmouth, and New Bedford. To avoid this huge expense falling on the town of Nantucket, state representatives for the islands and Falmouth, Dylan Fernandez, and the state senator for all of Cape Cod, except for Falmouth, Bourne, and Sandwich, and the islands, Julian Sear, wrote a letter to the governor and state legislature. They are asking that a portion of the $1 billion plus of transportation assistance the federal government sent to the Commonwealth be directed to the Steamship Authority. Currently, the steamship is scheduled to receive $12.2 million of relief funding in the next several months. Steamship General Manager Bob Davis said this amount is a welcome relief, but it's a Band-Aid. It's not going to solve all our problems. Senator Sear and Representative Fernandez has sent a letter to federal lawmakers. It asks that all future federal transportation relief now have a component that goes directly to the steamship. This way, the steamship won't have to ask the Commonwealth for a portion of the federal relief funding it receives. This Wednesday, the Select Board voted to write letters in support of these requests. The Federal Aviation Administration has notified Nantucket Memorial Airport that they intend to reduce the air traffic control hours of operation there from the current time of 6 a.m. to 9 p.m. down to 8 a.m. to 4 p.m. The Nantucket Airport would like the FAA to reconsider this decision. Assistant Nantucket Airport Manager and Public Information Officer Noah Carberg released a statement to NCTV saying, we continue to work with the FAA to make a data-backed case for our concern with their current proposal. We believe the proposal does not take into account the unique circumstances on Nantucket. I would also emphasize that this proposal is a Washington, D.C. level effort, and regardless of proposal outcome, our local FAA Air Traffic Controller Group does a great job for our community and has our support. Next week, the Harbor Master's office will open again after being closed due to the pandemic. They will begin preparing the infrastructure to accommodate private boats. The process takes several weeks, and they must first set up pump outs and dinghy docks before moving on to items like the moorings, which themselves take about 4 to 6 weeks to install. They aim to have the buoys in Nantucket by Memorial Day. Please note, just because moorings are going into the water does not mean boats can use them. Rather, they are only open once the harbor master makes the announcement. The virus has also affected the number of patients that come to the hospital. The volume has fallen by at least 60%. Hospital CEO and President Gary Shaw said the decrease is substantial and will probably cost the hospital millions of dollars. Partly as a response, the hospital is pursuing telehealth and telemedicine at an accelerated pace. Mr. Shaw hopes that it can increase the volumes of patients seen in the near future by between 10 to 30%. Due to its membership in the partner's health system, the hospital is getting some financial assistance from the organization to weather this storm. The hospital strongly recommends that everyone who cannot maintain social distancing of 6 feet or greater outside of their house wear a non-medical grade face mask. These masks still slow the spread of the virus. The medical grade ones are needed by the hospital and first responders. The hospital recommends, instead of donating your non-medical grade masks to the hospital, to donate them to the community. Washing your hands and social distancing remain crucial ways to slow the spread, too. This summer, we'll see some stores reopen and traditions resume in a safe and responsible way. Unfortunately, the 4th of July festivities will not be one of them. The hospital warns against large social gatherings this summer, like parties and meetings in close proximity. In order to monitor the spread, they stress the importance of identifying individuals that might be developing flu-like symptoms or respiratory illness so they can get tested. They predict this environment will be the new normal until a vaccine or an antiviral drug is developed. But please note that the cost of the COVID-19 testing is covered by all insurance carriers and is free to those without insurance. The hospital recommends anyone experiencing COVID-19 symptoms or another health emergency to seek testing. Treatment costs for COVID-19 hospitalizations are also covered for those with insurance, but not to those who are uninsured. Partners Hospital can offer a 25% discount for those who must self-pay, but 3/4 of the cost is borne by the patient. Therefore, those without insurance are strongly encouraged to seek subsidized health insurance programs for low-income individuals through the Health Connector. If they are a U.S. citizen, a Massachusetts resident if you're a Massachusetts resident and make less than 400% of the federal poverty level, they can qualify for Mass Health. The poverty level depends on how many people in your family. Please take a look at the graphic on your screen. You can see on the left that the larger the household size, the higher an income can rise before it shifts to the right of the table, meaning the health insurance costs increased. The health insurance premium can be found in the bottom row. The state's Children's Health Insurance Program, or CHIP, is rolled into Mass Health. Please be advised that children must be insured or else the hospital will bill the family directly. If you make less than 300% of the federal poverty level, Health Safety Net, unlike Mass Health, is available to everyone, even if you are not a Massachusetts resident or a U.S. citizen. Health Safety Net can act as a secondary payer for other forms of insurance as well. To insure more or for help navigating your options, please feel free to call the Cottage Hospital's public counselors at 508-825-8196. Now, let's move on to one of the many great acts of kindness that Nantucketers are carrying out during this trying time. Last week, I spoke with Patrick Ridge, owner and chef of Island Kitchen, about the support his volunteers and food trucks are offering to families whose children are out of school right now. Please note, the footage was shot on April 1st, before the advisory about face masks for all essential workers took place. So we just want to see what is Island Kitchen's role here on the island on feeding and getting all this information and food out there.
And so we are really just helping. Linda Peterson's really the unsung hero of it. Basically what's happened is the school needed a couple things. One, some of their staff weren't able to make it into work for a myriad of reasons. So we supplied some extra cooks to help with Linda. And Linda's been running the program, and we've been augmenting her program with a few cooks. And then we set up our food trucks so that people could have a nice, safe way to come in and pick up their food, where we could keep it hot or cold, and that the people could come in, a nice socially distanced way, and never had to go into the school.
So was this Linda's idea, or was it your idea? How did the idea come up?
So, well, actually, it was. We were kind of sitting at the restaurant, slowing down in those last weeks, and so we were cooking a little bit on Saturday, and I knew that the school was kind of in this thought process of closing, and as we were sitting there, we thought about all the kids that might be in need if the school was going to close, and and so it just seemed like the right thing to do, and so we just put it out on social media that in the event that the school closes and that there's no meals for them, we'll provide them. So, and then what really happened after that was pretty amazing. Some of our financial partners and some of our long-term catering customers and breakfast customers got together, and they put some money into the Nantucket Fund and the Community Foundation to kind of help Island Kitchen to be able to do this initiative. And so I can't take as much credit as we're getting, but we, it's just been a really beautiful thing, because everybody from our trash company to our to Yates Gas to a lot of our customers have all helped in this process, and I'm just so humbled by the fact that everybody's coming together right now.
It's been, I would say, very successful. So one of the things, speaking of that success, so how many families do you think have been served, and how many other organizations do you think have been served by this program?
Well, I think that, just for us right now, we're doing about 100 or so. Some days a little bit more each day, and so and then I know that, like, as these ideas started, a lot of other people did some really great things too, and so it's just nice to see that lots of other restaurants are jumping in, and that everyone's really, it's never been a better opportunity for public service to try to help people.
You're absolutely right. And what's the feedback that you've been receiving so far from the families and from others?
It's been overwhelming. I mean, everybody has just been so kind. I've gotten letters and calls, and I mean, phone calls and offers of donation and in-kind services, and volunteers from honestly, from people you would never even expected. I mean, it's just blown my mind.
How many volunteers have you had? Have they just showed up? Have they been calling you?
They've been calling, and like almost probably 5 or 6 other restaurants offered their staff, offered supplies. I know, like Matt Fee's been dropping off some bread now, and we've been, throwing a loaf of Portuguese bread in the bags, and it's been really great, to be honest. I actually, I only wish that we could be doing more, and you're starting to see that spread out into other businesses, and because there's a lot of need right now.
Absolutely, and we definitely don't want to think of a world in the absence of these programs. We really appreciate the work that you've been doing.
I just can't say enough. Nantucket's been good to me, and it's been good to my team, and we're honored to do whatever we can to be a member of our community.
And now, a quick programming note. Gary Shaw, Dr. Sharfstein, and I will discuss some of the COVID-19 topics we feel are more important to Nantucket. Afterwards, I will announce when we will be opening the floor to questions via the YouTube chat from viewers logged into our YouTube accounts. Now, I would like to introduce Dr. Joshua Sharfstein to the program. Not only is he an excellent source of information about public health, but he was also my advisor in graduate school. Welcome, Josh. How are you today?
Thanks for having me, Roberto.
Absolutely. Thank you for being here, Josh. So one of the things that is burning a hole in all of our pockets about questions is this COVID virus that just popped up out of nowhere. What are the chances, or even the possibility, that herd immunity would be even reached within this year?
Well, I think pretty low. I think unless we decide to just let everyone get infected, which could be quite dangerous. So the situation that we're in is that we have a highly infectious and quite dangerous, and to many people lethal, virus that is spreading around the world because nobody has any immunity to it. It's a new virus. And if left unchecked, it would go through the population very quickly and could lead to many, many deaths, so many that the healthcare system wouldn't be able to take care of all the sick patients. And so that's what started to happen in Italy. It's what happened initially in Wuhan, and we've acted very quickly in the United States to prevent that with the extreme social and physical distancing that we've done. If we were to relax that, and not do anything else, then a whole bunch of people get infected, and we'd have that worst case scenario happen. What we're going to try to do, though, is keep the number of infections down in order to buy some time to get a vaccine and treatments and strengthen our public health response capacity so that we can not have so many deaths, but still be able to move forward with our economy and society.
Thank you, Dr. Sharfstein. Gary Shaw here. Just a question, and I know it's on everybody's mind, but when you look at how this is spread around the world, and many communities have been able to do some precautionary things, they're working through what they're seeing for COVID in their communities. What are you thinking is the possibility for a second wave of COVID or a third, or what's the resilience of this virus, and how would you advise us?
I think that there's a very high possibility of a recurrence of a peak, either a second wave or a third wave, if we let down our guard. And so I think it's very important to take this virus very seriously. Basically, we have been able to avoid the total catastrophe that we feared by taking a lot of very serious actions. It is the fact that we're staying at home that has kept us safe. And so we have to be very careful in reopening. Otherwise, there's every reason to believe the virus will just start passing between us again. So I would say that it really depends on us to a certain extent. Now, we do have an extra risk in the fall with the flu season and other respiratory viruses hitting at the same time. Both because maybe it'll be a little easier to transmit, and also just because we'll have so much more illness out there. So overall, so that's going to pose a special risk this fall. But truthfully, we could have a spike any time that we let down our guard.
Actually, along those lines, that's a very great point. We actually had a question from the public, and if you're watching at home, please feel free to put in any questions on the YouTube chat as well. But we had a question from the public that says that since we've gone 3 weeks without any new cases here on the island, which is no small feat of its own. But now we're having questions about entering maybe phase 2 of what the president's recommendation was for reopening. Do you foresee entering these phased reopenings anytime soon? I know here on Nantucket, we've slowly reopened landscaping and construction, and we're looking into implementing some of the restaurant industry to do takeout and curbside delivery only. But do you have any idea of a general timeline on where we would be even slowly moving back to normal?
Well, I think it's a slightly bigger question for the country. And then there's an important question for Nantucket. So the bigger question for the country, it really will depend on the region and the status. We really want to see certain things in place before starting to reopen. And then we want to go slowly to make sure we're not going to have that big recurrence. So we want to make sure there's adequate testing capacity, that the healthcare system is resilient, there's a good public health response capacity. Those are all examples of things that really need to be in place before you start turning the lights back on. I like the analogy of we had to flip the lights off, but when we turn it on, it's going to be like a dimmer switch. We're going to have to go slowly to make sure we're not provoking a big outbreak. Now, Nantucket is in an interesting situation because you all have responded, very effectively, and now don't have any cases. So, if the whole world were just Nantucket, you might be done. You'd wait maybe a few more weeks to make sure after a couple incubation periods of the virus, and there'd be no more virus. Unfortunately, there's a whole world outside Nantucket that can show up with the virus. And the tests aren't perfect, so it's likely, if not inevitable, you'll get more cases on Nantucket as people come on and off the island. So I think it's just going to be very important to be vigilant and be able to respond rapidly as cases reappear.
Thank you, Dr. Sharfstein. Gary, with one more question. That's probably the topic that I get the most questions about, and that's vaccines, medicines, antivirals. Can you shed a little light on what you might know is evolving related to development of those tools in the world?
Sure. So there are different aspects of let's talk about medicines first and then vaccines. And so for medicines, there are different aspects of the disease process. First, the virus gets in, then it starts to replicate, then people get very sick, And then you can have this very serious immune reaction at the end, which causes the lungs to really falter. And that really leads to death. So at each step, there are potential medicines. To block the initial replication, some people have the idea of giving antibodies to people very early on. And antibodies might be able to block the virus from getting in and starting really to replicate. That would be a very good and early effort. And there are some studies going on about that. Then for viral replication, there are drugs that stop the virus from replicating, from copying itself inside cells. Now, whether those drugs actually work in human beings, that's being tested. So we don't know yet. And there's been some mixed results coming out a little bit, but we haven't really seen the full studies. And then there are other therapies that work at the very end, hopefully to prevent that last horrible immune reaction that can lead to the lung failure and death. So we're going to see the results of a whole bunch of those studies, including, I'm sure, some other ones as people think of other things to try. I would expect some of those results have come out. Unfortunately, they haven't found any success yet. Other results have come out in the next weeks and months. The vaccine is a different challenge. The vaccine, what you're trying to do is prime the immune system. So then when you actually are exposed to the coronavirus, the immune system doesn't, give it any chance to make you sick. And there are a bunch of different types of vaccine technologies, and a number are being developed. I think there may be more than 20 candidate vaccines that are being pursued right now. And we don't know which, if any, are going to work. So it's going to take a little while first to assure that the new ones are safe, and then to really test to see if they're effective. And it's really important that they be safe and effective, because a vaccine is something you give to a lot of people. So you want to make sure it's as good a product as possible.
Yeah, thank you for that.
Okay, so we're going to move on to some questions from the public. First one is from Mary. How should susceptible people behave differently from generally healthy people to protect themselves?
It's a great question. I'm assuming by susceptible, she means susceptible, particularly at risk for serious illness. Everybody's susceptible. Yeah, everybody's susceptible. Everyone could have serious illness, every single person. But some people are at higher risk for serious illness, people over 60, particularly people with chronic illness. And I think people in those categories have to be extra careful. Everyone has to be careful. They should be extra careful. They should also really look specifically for guidance that's intended to help them. And that really means vigorous hand washing regularly, staying at home as much as possible, avoiding crowds whenever possible, wearing a mask outside, and really keeping your distance from people in public. So there's a whole bunch of things people can do, and it's extremely important for everyone, but extremely, extremely important for people who are more susceptible to serious illness and death.
Excellent. The next question, you might actually know who is asking it. The next question is from Aaron. Can you speak as to why some people seem to get sicker than others? And are you aware of any genetic studies like that of the ACE2 gene? And if you do, can you explain the ACE2 gene?
That is a great question from Aaron. Please give Aaron my best. I would say the answer to that is there are a few different genes that conceivably could be involved in why some people get sicker than others. And it also could relate to the genetics of the virus itself. But there have not been studies that have really established it. The ACE2 gene encodes for a protein, which I believe is the protein that is the way the virus enters cells. So a virus that can't affix to a human cell never is going to cause disease, because it can't get inside to take over the cell. That's what viruses do. This is a particular protein that the virus can adhere to, and then that allows it to get inside the cell and take over.
Excellent. And then just one last question, and then we'll move to the public Q&A, and I'll send you on your way. I know your time is very valuable.
Okay.
Our last question from Michael is, what are your thoughts on face masks being required on restaurants and bars while they're there to eat and drink? Should we be implementing that?
Yeah, it's a good question. It's kind of hard to imagine how you're eating with a face mask, isn't it? I think that we're going to have to rethink restaurants and bars a little bit in order to maintain a distance. I think people who can wear face masks, like the bartender, probably should be. People who are eating should really be apart from others besides their household contacts by as much as possible. I think we're going to see a lot more dining outside because I think the outdoors, you get a lot more air circulation. It's going to be a little better. Less chance of having the virus circulate. So I think things will be different. But until we can eat with other than our mouth, I think it's going to be impossible to be wearing a mask the whole time.
Absolutely. Dr. Sharfstein, Josh, I really appreciate you coming on today. We really thank you. We know your time is very
let me just say
valuable.
I've really got a chance to learn about both the hospital's response and the health department's response and the way that community of Nantucket has come together, and I'm just very impressed. I think you all have demonstrated that you can have a great spirit of collaboration, and the way you defeat the coronavirus is by coming together and using the best scientific information to make a difference, and that's what you're doing in Nantucket. So thanks for having me, Roberto.
Absolutely. We really thank you for taking your time out. We know you're very busy.
Okay, take care.
Take care.
Bye-bye.
Bye. And now for the last few questions for the day, before we move on to our hospital statement. There was one question from Dan. Do you have any sense of when marine facilities will be allowed to go back to work in some capacity, like Nantucket Marine? Well, if at the select board meeting on Wednesday, Dan, you may have seen that that the marine and the moorings are allowed to start work now that the harbor master is getting back to work on Monday. We'll be able to start that process. So really soon, especially starting on Monday. And then the next question from Dan is for Gary. What preparations are being made for the second round of infections when more people arrive from the island?
Yeah, thank you, Roberto. That's a great question, and I think it builds on what Dr. Sharfstein had indicated, that when you have a prepared medical system, it comprises a number of things. It comprises the opportunity to do testing, to do early diagnosis, to be able to do the screening in a number of ways in the community so that we find early illness, and then to do quarantine, contact tracing, and then move into a phase where the quarantine effectively eliminates or breaks the chain of the COVID ability to spread. So what we have done over the last 2 to 3 months is prepare, and the town and you gave us the time to prepare. So we brought things together. We have more testing materials to do screening at the screening areas. We've isolated our hospital so that the COVID typically can't come in unless we want it to come in through areas that are what we describe as hot zones. We've trained the staff. We've run multiple scenarios and taken care of COVID patients. So what we've done through the time you gave us has been to prepare. And now we're at that precipice where we're leaning into the community to be able to do early due diligence out in the community, find disease if it's there. But a great amount of the second wave, if it does come, and we do expect to get cases, the responsibilities lie on you in the community. We're an advisory group that gives you some guidance on what to look for and how to behave and how to social distance, how to protect yourself. But the responsibility truly lies in the individuals that are here or coming here to self-validate each day when they get up. If they've got new muscle aches or a new respiratory infection or they just feel off, you should call us at the Cottage Hospital so that we can walk you through whether or not you would be a candidate for screening. And if you are, then come get screened. And if we find that there is some COVID, then we would want you to quarantine and we would contact trace the individuals that you've been around or near. So those are ways that you handle it. It's a tried and true methodology. I think it was challenging when you see large, dense areas such as Boston and New York, where people are highly dense, not even knowing that they have a disease, transmitting it, and it could get easily away from the public health authorities to find it, track it, quarantine it, and then stop the chain. We're in a different scenario here now, and we feel that we're prepared to meet the need. And we're also working closely with MGB, the Mass General and Partner System, to get support when we need it. So our goal was never to not have COVID. Our goal was to keep it flattened. You've crushed the curve here, so it's a straight line. But now we do know that there's resilience over on the coast, and we can transport patients when necessary, and helicopters can fly, and we do have more ventilators here to help people in the short term if necessary. So we've done some good planning. We still don't want to be overrun, though, and so what we have to count on is you, the public, to help us stay safe.
Thank you, Gary. And for one last question from Judith, will Nantucket allow for hotel rentals if the rest of the state does? Well, Judith, the hotel closure was only done by the governor. So as soon as that order gets lifted, we will be allowing the rentals to continue. Right now, they have the state has barred all rentals less than 31 days. So 0 to 30 days are still not allowed by the emergency orders. But once that is lifted, that is allowed. We will allow that again. Just make sure you sanitize and follow the CDC guidelines between lodgers. So we really appreciate it. So Gary, before we move on to your hospital statement, so we were just curious. We wanted to say thank you for everything, and we heard you're on today's N magazine cover. So what is your opinion on your picture?
My wife said it was a nice picture, so that makes me happy. But I was quite surprised, and quite honestly, the honor for any recognition through N Magazine for this COVID outbreak doesn't go to me. It goes to the staff of the Cottage Hospital, our medical providers. They're the individuals doing the work. I'm only helping point directions and giving advice, so I'm quite humbled by being on that cover.
Well, we definitely appreciate all the hard work that you and your staff are doing. Thank you very much.
Thank you, Roberto.
Thank you.
Well, thank you. So I just wanted to reach out and give you a few words and let you know that I believe that this island has done an extraordinary job in not just flattening the curve of COVID-19 infections on Nantucket, but man, you steamrolled it. It doesn't exist right now because of your efforts. It's a flat line, but you know, we've gone nearly 3 weeks without a confirmed case of COVID-19, and it's been more than a month since our first case was diagnosed on Nantucket. And so I go back to you and say thank you for your work. I do recall saying that if you followed these guidances from the health department, the town, and the hospital, I promised that you could do this, and you have. So thank you. To our year-round community, I can't say thank you enough for everything you've done to make this possible. You heard our message and you committed to the measures that have kept our community safe. And so we begin to work with the town on a slow and measured approach, returning to some work in some limited industries. And we ask that you continue to commit to those things that you know you've worked on, such as physical distancing, hand washing, wearing masks in public, limiting trips to the grocery store, and following the town's emergency orders. To our seasonal residents, as you consider a return to the island, we want to give you some guidance and best practices to assure that the summer will be as safe as possible for everyone on Nantucket. And to that end, there's also a document coming out that we've helped pen from a town, a hospital, an island, and a Cape perspective that will give guidances and umbrella guidance to the rest of our areas so that all that come back can benefit from the same information. But this island is giving you some specific information tonight, early, because we know you want to come home. So the island's had a chance to emerge from the coronavirus pandemic, and it probably is going to be an early public health success story. With our population safe and healthy, but despite our initial success, Nantucket remains highly vulnerable to infected persons and asymptomatic carriers of the virus coming from off the island. And whether that is coming from seasonal residents or it's coming from year-round residents going back and forth, or it's workers or day trippers, any of those could prompt a major surge in new cases. So if you are considering a return to the island, we ask you to be a part of our success story by taking the following actions to ensure the continued safety of our community. Self-quarantine for a minimum of 14 days once reaching your destination. It's best to go directly to your destination and don't stop elsewhere on the island on the way. Bring all the necessary food and supplies with you to enable the 14-day quarantine, or have it brought to you. There's a website through the Chamber that has a number of individuals listed that can help deliver things, including prescriptions, personal health items, and personal protective equipment, or we call it PPE. You can always contact us at the Nantucket Cottage Hospital by calling 508-825-1000. And if you're exhibiting flu-like symptoms or experiencing respiratory illness during or after quarantine, we want you to receive instructions from us on accessing appropriate care. Please comply with all local, state, and federal directives and recommendations regarding physical distancing and other measures to limit the spread of the virus. Please wear face masks in public places when distancing physically is difficult. Refrain from hosting or attending private home parties or large gatherings. COVID needs to have parties and it needs to have large gatherings to spread. So let's not do that so that we don't spread this disease. Instead, order takeout, food, or have it delivered from local restaurants. Be diligent with hand washing and disinfecting much used surfaces and limit trips to the grocery store if possible. This guidance will continue to evolve over the spring and the summer. So please check the town of Nantucket and Nantucket Cottage Hospital's websites frequently for updates. We know the summer will be unlike any that came before it, and it will take some time for all of us to adjust to the new normal. This is not going to be the summer for parties or large gatherings, and I want to stress that. This is not going to be the summer for parties or large gatherings. We want to ensure that the measures which have so far kept the community safe are embraced and practiced by everyone that's here on Nantucket. And now I'd like to give you an update on coronavirus testing at the Nantucket Cottage Hospital. Nantucket Cottage Hospital established one of the first drive-through testing sites in the state of Massachusetts on March 16th, and we've tested more than 250 patients for COVID-19. And 240 of those tests have been negative. As you know, we've had 10 confirmed cases of COVID-19, and 7 of those patients are considered recovered, with 2 still in isolation, and sadly, very sadly, 1 death as a result of complications of the disease. We're actively working to expand our point-of-care testing capacity. We call that PCR. And the criteria for testing patients at our drive-through and those coming into the hospital continue to evolve on a daily basis. We are now testing all patients admitted to the hospital, including those admitted to the labor and delivery unit and their spouse, along with patients who are considered high risk into the emergency room. We have some capacity to process COVID tests internally with the Cepheid analyzer in our lab. We have kept those tests available for admitted patients and for situations in which time is of the essence to enhance patient care, to both preserve personal protective equipment and to allow frontline workers to return to work faster, including our first responders in the community. Simultaneously, we're also pursuing a small serology study that would test a significant portion of the island population for antibodies and show whether those people have been exposed to the virus. We're working day and night to make this happen for the island and collaborating with our partners at the Mass General and the MIT Broad Institute, as well as Harvard, and one of our board members, Dr. Jeff Drazen, who is a member of our Nantucket Cottage Hospital Board of Trustees, as well as a physician at Brigham and Women's Hospital. We still have some hurdles to get through, including funding and approval for the study through the internal review board process. We call that an IRB. But we are optimistic that this can happen, so stay tuned for that. No final decision yet. We're still working on that. Finally, we want the community to know we are here for you and open for care. Let me say that again. We want the community to know we are here for you and we are open for care. So please know that it's safe for you to come to the hospital for any care that you need. We have taken every precaution to protect our patients and our staff. And so we want you to know that it's important to never, ever delay coming in for care. If you have an emergency or an urgent issue or a health matter that's not urgent but needs attention, please come in or call us. We're set up to care for you safely, as well as through virtual visits, by video and phone. Lots of options for you to receive care. Again, please don't delay the care you need. The hospital is a safe and ready place for you to come for care. And thank you.
Thank you, Gary. We really appreciate everything the hospital does. They're our lifeline. So now for the Nantucket rumor report. So one of the things that we want to definitely respond to, and we're hearing a lot on social media right now about comments made about maybe injecting disinfectants and how that would affect the COVID-19 virus. We are asking that you do not inject any disinfectants into your body. That is definitely a rumor as of right now. And we do know that there's a lot of research being done on what sort of antiviral, which is most likely what was meant when this comment was made, antivirals or things like that. Research is being done to prevent that sort of an issue. Injecting any sort of, or ingesting any disinfectant like Lysol or chlorine or anything like that is poisonous and lethal. So with that, I think we can move on to the next section. We will continue to provide you with updates on the coronavirus and impacts for Nantucket. This week, Nantucket Pulse debuted a wellness segment series hosted by Natalie Simonero with our local health professionals on Channel 18 and nctv18.org. Please share this with friends and family. It's designed to connect our viewers with local health professionals that can help us take care of ourselves and others around us. It's important that communications remain in place as events continue to unfold and we all remain connected. It's crucial to get the facts from your local news sources, such as the Inquirer and Mirror, 97.7 AC FM radio, and NCTV Channel 18. Please stay tuned to see a special message from our essential workers from the community. I am Roberto Santamaria, your health director for the island of Nantucket. Thank you so much.
We want to thank all the essential workers and medical professionals
and first responders and town employees and stop and shop workers and
the teachers who are working remotely, people who are all doing what they can to save us while we do what we can by staying inside.
We are so very appreciative and we'd like to clap for you. Thank you for everything you're doing for us.
Thank you.
Thank you.
Thank you.
Thank you.